Hi, I'm Alana. I'm 23 years old, and I'm a current resident of Pennsylvania. This is just my personal story, specifically on health insurance, and I just wanted to share it with everybody, so just to have an opinion, I guess. So let's start this. Okay, so at my old job, I worked there for about a year and 2 months, and for the first 9 months is when I didn't have health insurance. I was working an average of 45, 50 hours a week. And I kept getting promised that I was going to get health insurance, and it never happened. I contacted my HR, and she said I would get the forms within a week. And after a week came, I talked to her again, and then she said another week. And this just kept happening over and over again. Eventually, my boss actually came and talked to me personally and told me that by the beginning of January I would have health insurance. And I said, okay. So January came and went, and then I contacted our new HR, who then told me that I couldn't get health insurance because my numbers were too high. And that if I wanted health insurance, I would need to bring my numbers lower. I won't get into what those numbers actually mean and what they represent, because that shouldn't matter when I'd been there for over 9 months then and working way more than full-time hours and not getting any health insurance. So after that, I stayed another 3, 4 months, and then I found a new opportunity, and I went for it. I told my new boss my current situation about the health insurance, and he told me that he would give me health insurance right away. So, and within 2 months of working there, I got my health insurance. And that's great for me. Now I have I can relax. Because, I only have myself. I used to be in my father's insurance, but he passed away when I was 22. So then I was on my own. And if something went wrong, and I had to go to the hospital or anything, I knew it was going to be a very big bill. So now that I have insurance, I can calm down, not worry so much. I know I'm covered. And the reason why I'm sharing this is because there's other people who aren't as lucky as I am. I found that new opportunity and a boss who cared. A lot of people don't have that. I know a lot of my old coworkers who are at that old job are still there. And I don't think they're going to be leaving anytime soon because they don't have another opportunity. They're stuck there. And a lot of bosses of a lot of companies know this, and they do what they did with me, and they just keep stringing you along so they don't have to pay health insurance. And since there's no other opportunities, they get away with it because the people need the job, so they know they're not going to leave. So that happens. And the second part of this is for the Affordable Care Act. I honestly don't know why people are so against it. I would love actual a one payer system for healthcare. In Canada, everyone's covered. You go in, and maybe it's like $20 to get to for whatever. But apparently, we still can't get that here. But what we have now is better, where everybody can get insurance, not just because you have a job. Like I said, I was lucky I have a job that cares, and I got the health insurance. There are a lot of people out there who are still working 40 hours plus weekly, and they're only considered part-time, so they're not eligible for health care or whatever. So, I guess people are upset because they're paying a little bit higher premiums, or people are getting taxed more, so that everyone can be covered. And honestly, I don't see anything wrong with that. If I can help someone who doesn't have coverage get the treatment they need so they're not suffering or die, I think that's just our part as a human being to help each other out. And I feel like it's selfish that people don't want to chip in. I mean, we're all in this nation together. It sounds a little bit weird, but everyone should be for everyone. Everyone should help each other out. And then people are getting on like this thing that since the Affordable Care Act, people have been quitting their jobs. And I don't see that as a bad thing. It's because these people aren't tied down to those jobs anymore. People might be working at a job they hate just so they can have health insurance. And now they found out they can get health insurance without being tied to a job. So they can go to a job they like and get health insurance that's not attached to it. You shouldn't be denied health insurance just because you don't have a job. That's ridiculous. It's just injustice. And they're calling those people lazy and whatnot, but that's not the issue. We are still coming out of recession. There's still economic problems. There's still not enough jobs for everybody. That is a problem. So now that these people quit their jobs because they could and they're not tied to them anymore, that leaves opening for other people. I think I want to say that covers it, but I feel like there's more to be said. I just wish everyone would give it a chance before they're already just totally against it. Like, that's the other thing is people were being denied healthcare coverage because of pre-existing conditions. Those are the people who need it the most because they're the ones who are going to the hospital or doctors the most to get treatment for those conditions. The people who need the most help are the ones getting denied it. So I still don't see anything bad with this new Affordable Care Act. I don't know. I'm all for it. That's all. Thanks for listening, I guess. Okay, just a quick correction. I didn't work there for a year and 2 months. I actually worked there for a year and 8 months. Just to clear that up.